Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today we will be talking about ringworm infection. So a ringworm is a fungal infection of the skin which is contagious in nature. By contagious we mean that it spreads from one person to another by contact. The incidence of ringworm or fungal infections is highest in humid weather. So in a city like Bombay, where there is so much heat and humidity, the incidence of ringworm infection is also very high during summers and rainy season. In summers, as we all know, we tend to sweat a lot more. The skin remains moist for a long time, inviting such infections. In rainy seasons, again due to rains, because our clothes remain wet and skin remains wet, these infections tend to be at a all-time peak. Now let's see which area of the body it affects. Fungal infections are such that they affect the skin right from head to toe. Depending upon where the lesion has arrived, or where they have affected, or where the ring is formed, it is divided into different parts depending upon the anatomical location. So when it affects the scalp, we call it tinea capitis. Fungal infections or ringworm infections are referred to as tinea in medical language. So on the scalp, it is tinea capitis. If it happens in your beard area, then it's tinea barbae. When it happens on your chest or your back, that is your trunk, then it is referred to as tinea corporis. When it affects your inner thigh folds or groin area, it is called as tinea cruris. When it involves the places in between your toes, these digits in your feet, it is called as tinea pedis. So depending upon the different location, it will be diagnosed as a different thing. In bottom line, it is a fungal infection, a ringworm infection. So let us see what are the symptoms of this. As the name suggests, ringworm, there is a small ring which is formed very early in the disease. Initially, the ring can be as small as 1 centimeter. Sometimes the ring is not even seen. What the patient experiences, there is a dry spot where the color is a little different from the normal skin color. A few weeks or months later, this small spot becomes a ring, which is a precise ring. They can even see it now, which has a reddish border and it itches very profusely. A few more weeks later, the itching has become very intense and the circumference or the diameter of the ring is also growing. Now, instead of one or two rings, there are more rings on the body. As the months or days progress, the entire body can get involved. The most painful part of this condition is the painful itching. The itching is so much with scratching that at times they will search for a sharp instrument to scratch themselves, and the more they scratch and tear their skin, the further and faster the infection spreads. So let us look into the treatment of this infection. Once again, as we have said, we will divide this also into two parts. One is a lifestyle modification and second is a homeopathic treatment. For lifestyle modification, we have already talked that because this infection grows in moist areas, we have to see that we keep our skin dry. Immediately after a bath, we have to keep ourselves dry. Personal hygiene is very important, which means you cannot wear the same clothes for 2-3 days or same inner clothes for 2-3 days. Everyday bath is important. Plus, if you are having an infection, to prevent it from spreading to the other family members, your clothes should be washed separately in hot water. So this is how you maintain a lifestyle. Second is homeopathic treatment. Here it is important to note that while patients come to us for ringworm treatment, they have already a small file which has 2-3 opinions from skin doctors. These people have applied lotions, have applied ointment, and the typical history is while they are applying anything, they are better. Once they stop the application, the infection comes up again. So as we see, this is a very difficult one to treat. For homeopathy, for like any other illness, we will require a detailed history. The reason being that we do not give anything to apply from outside. This infection occurs and spreads more when the immunity is involved, when the immunity is lowered. So basically, while we give you a treatment, we give you the pills. It is not an antifungal. You are not taking anything which is going to work against the fungus or kill the fungus. You are not taking an antibacterial. You are not taking an antiviral. What we are giving you is a medicine which is going to work on your immunity. Your immunity is going to be boosted, and that modified immunity is going to cure you from the problem. Hence, even for a small ring-like eruption, we require a detailed history. Now, here two histories are important. First, what we always take is the details of your lifestyle, your personal stress, sensitivity, the events that you're going through, the disturbing emotions, and your reaction to these events. Second history, which we also require in great detail, is the history of the itching. For example, if we would have 10 patients with ringworm who have intense itching, we would give 10 different medicines to each of them. The reason being their body's response or their immunity's response to this infection is different. For example, while for one person the itching will be maximum in the night, for the second person the itching may be maximum after a bath. For a third, the itching is intolerable and is better only after he washes the part with a warm water. For fourth, the itching increases after they have a good meal. So this is how their immunity or their body's response to the same infection varies, and these are very important for prescription because, as I said, we will be working at the base of the immunity to improvise the immunity and cure the infections. Hence, even for a skin infection, we require a detailed history. So with all these factors considered, a medicine is selected and prescribed. As I've already said, fungal infections are the ones a little difficult to cure. So I give the highest potencies first, and the patient start responding quite early. In the first month, we start getting very good response from the patient. As the skin gets better, the normal skin starts to appear, which means the skin which has become brown will slowly become red again. After that, it will again go back to the original texture of the skin. The ring is broken, which means a month into treatment, they will not be able to demarcate the ring, which means the activity of the lesion has gone because it spreads like a ring. The ring keeps increasing. Once you have broken the ring, the infection is in control. And then the normal skin starts to appear. Itching responds earliest in the first week itself or a first few days. They will tell you that their itching has gone down by 60-70%. And when they tell us that, we know that we have cracked the case. Here again, while also they are in treatment and also after they have finished the treatment, we tell them that they have to maintain their personal hygiene. If they don't maintain personal hygiene, they are bound to have a problem like this again. And in personal hygiene, we talk to them very clearly that they have to go for clothes which are of cotton for preference because cotton will absorb the sweat. Nowadays, we are seeing increased incidence of ringworm because of synthetic fibers used. They do not absorb sweat and making us more predisposed to skin infections. So this is how, with the correct modification in the lifestyle and homeopathic case taking with the depth of the case, we treat ringworm infections. As you all know, I have recently authored and published a book on materia medica, that is homeopathic medicines, titled Unlocking the Bogus Synoptic Key. This book is available on Amazon. I am currently practicing in Dadar West Shivaji Park area. My OPD timings are afternoon 1 to evening 7 pm. On Mondays, Wednesdays and Fridays, I practice at Park Polyclinic 5 Shankar Nivas, Dada Saheb Regemar. And on Tuesdays, Thursdays and Saturdays, I practice at Saplace Polyclinic, Malik Building, DV Deshpande Marg, Shivaji Park Road number 4. You can also follow me on Facebook, Instagram and YouTube. Stay happy, stay blessed. Thank you.